So in addition to the explanation of the criterion and the bills that were proposed into the diagnosis of polycystic ovarian syndrome, I'm also going to explain a bit more about endometriosis. So endometriosis is actually a gynecological disease that's very debilitating and can greatly reduce the quality of life of the patient. So essentially, endometriosis is the relocation of the endometrium, which is the lining, the blood lining of the uterus, where a fertilized egg would implant into becoming a full-blown embryo. So it can relocate into ectopic areas, and there are three kind of prominent areas that it can relocate into. The first one is pelvic peritoneum, the ovaries, and even the bowel. So the gold standard at the moment in diagnosing endometriosis is a laparoscopy, which is a surgical lesion procedure. But there are many downsides to this procedure. As for one, it is surgery, so this comes with risks, as well as the fact that it is an invasive procedure, as well as the cost. So the average cost at the moment for a laparoscopy is €9,700. Because of this reason, and because we need to really diagnose this as soon as possible, another thing that we can do to diagnose endometriosis is blood biomarkers. And with blood biomarkers, it's just a blood test, which would give us the levels of the biomarkers that we are looking for that could cause endometriosis. So one of the blood biomarkers, the main blood biomarkers that we look for are glycoproteins, as well as immunological and angiogenesis biomarkers. So the first one biomarker that we can use is CA125. This usually correlates to the severity of the disease, so endometriosis. However, it's not that good as a biomarker for endometriosis because it's also used as a biomarker for ovarian cancer. So as you can see, there could be misleading information there, and we wouldn't know which one causes what the biomarker is the cause of. The increase of this biomarker is the cause of. So along with this, another glycoprotein that we have that we look for is follistatin, which is another glycoprotein, and it's increased in patients with endometriosis. However, we are unsure of the specificity and sensitivity of this biomarker. So previously it did have good sensitivity and specificity. However, now we are unsure because a follow-up study could not reproduce the same percentages in the specificity and sensitivity. Along with this, we do have other immunological biomarkers such as interleukins, a number of them. However, again, we are unsure if these definitely correlate to the presence of endometriosis in a patient, and so it might be that we would have to do a laparoscopic examination to understand the presence of endometriosis and then form a treatment for it. So to conclude the diagnosis of endometriosis, it is important to understand that the diagnosis of this is significantly important to understand, because 2 to 10% of women in reproductive age have the prevalence is this, as well as those with unexplained infertility. It is present in 35 to 50%, so this is a pretty large amount. And if you wanted to know any more about endometriosis and as well as PCOS that I mentioned in the earlier video, I will add some links to videos that you can watch, as well as some hyperlinks in the text.